Hi, my name is Raffi Minasian, and I am the Medical Director of Home Dialysis Centers. We are dedicated to providing customized care for our patients in the setting of where they live. And our program actually began back in 2005, and we were the first to actually get a home dialysis center that was standalone and not doing hemodialysis also. Certified in Orange County back then. My partner Sean Moravian and I each bring a different expertise to this, and I'm, as a medical director, dedicated to providing all the different kinds of dialysis that should be available to a patient the same way I would want it if it was me who was getting that treatment or my family member. And my partner Sean Moravian has technical experience and was the director of technical operations in Canada for one of the world's biggest dialysis companies before we came to California together to do this. And since that time, we've branched out from being experts in home hemo to also doing peritoneal dialysis. In the spectrum of things that we provide dialysis at home with assistance as well. Those who would be complex cases, tracheostomy with ventilator and general tracheostomies are not accepted in dialysis units. Also very large patients who don't fit in the chairs, and essentially there's patients who, for behavior reasons or for soiling or wound reasons, are not appropriate to be taken to a dialysis center. We can assist in those cases, and in general, anybody who's being transported to a dialysis unit by a gurney or an ambulance could be taken care of at home. Patients who fit in any of these categories can contact us, and we would be contacting their insurer to get them covered. This is a population that we have now, and I can think of patients who are over 500 pounds who were not able to be accommodated anywhere. We're being transported by ambulance huge distances just to get any dialysis services. We stop that transport and that patient and do her at home, and she has fluid problems, and I have to do her 4 times a week. So we can accommodate whatever the circumstance is, and that's the beauty of our program. It is really tailored to the patient's needs. A lot of this depends on the support that's available in the home setting, and some of that could be the family, and sometimes families can afford to pay for outside help. But we are in a position where, regardless of what your clinical situation is, I can take care of you at home. Our program in Orange County and in Rancho Cucamonga serves the entire Southern California area. We started in Orange County, picked up Los Angeles County, and then went into San Bernardino County after that. We provide conventional peritoneal dialysis, conventional home hemodialysis, and assisted home hemodialysis. And our program at this time is staffed with those who have a tremendous experience in the field. My lead nurse in Orange County has herself had 3 kidney transplants, was on home hemo, was on peritoneal dialysis, and we try to focus on using people from the community from the dialysis community, the renal community, to be part of our employees. The annual dialysis conference, which is the largest dialysis meeting in the United States, was held in San Diego, and in March of 2024, I was awarded a Quality and Leadership Award for my work, and that was really about the work I've done in home dialysis, and I was recognized by the national organization for my work in home dialysis. The video I did on YouTube is 15 minutes explaining all of the things that I consider important for a patient to know about fluid and how it affects our life in dialysis. And that 15-minute video was presented at the annual Nephrology Nurses Association meeting and has thousands of views. It really is educational on why you should be worried about not having too much fluid accumulate between dialysis treatments, which is the driving factor of why dialysis at home makes more sense for patients who want to protect their long-term health. We try to focus on using family members of our patient base and the community, the renal community, to be part of our employees so that they stay connected. And what I do personally is I try to treat patients as though they were my family, as though they were somebody I care deeply about. And in saying that, what does that mean? That means I give every one of my patients my cell phone number, and our technical department gives them 24/7 access to somebody. Our nurses are available 24/7. So you have a doctor, a nurse, and a clinical technical backup that's always available to you. What does that mean? Well, I think that means we're providing concierge service. We are providing customized service to you, and we provide care at home in a way that other facilities don't, that are restrained by corporate edicts. We will send nurses to the home much more often, technical people out to the house much more often than, for example, the big companies would. They would be limiting their nurses' activity outside the center, the miles, and worrying about liability. We only care about what's best for our patients. So over the years, we've distinguished ourselves because we have extremely good transplant rates. Our patients get transplanted frequently. We have good relationships with all the major transplant centers in California, but importantly, we utilize out-of-state centers to expedite transplant process. So we're worried about your overall health, your life as a patient. We want to walk you through and make it easiest for you. The other thing that's distinguishing our facility is we have extremely low hospitalization rates. That speaks to the quality of the care that we provide, that our patients don't end up in the hospital. They get transplanted though. So our quality is one that is driven by the fact that our nurses are experienced, and I myself have been focused on home dialysis for a long time, before home dialysis was popular. And the reason I say that is because home dialysis was the one way that I could provide better control of the one factor that I believe that wasn't being addressed in conventional dialysis, which is that we don't control fluid very well. The one solution to this is more frequent treatment, and to do treatment more frequently, it really is calling for us to do this at home on a schedule that you can determine, and on a schedule that's not going to impede the rest of your life. That's what our program's about, is customizing our care so that you can get the most out of your life and have dialysis not be an impediment to your going on and doing the things you want. Also to facilitating you to get off dialysis and get you transplanted. Now, what does all this mean? This means that we are a concierge center, and one of the things we can provide is customized care in the home setting on your schedule. If you need help and you want to have an assisted home, that might be something your insurance might cover if you have a PPO plan, but in general, that would be something that is not paid for by Medicare. It's something, though, that is available for those who can afford it, and in those circumstances, we can tailor the amount of assist to being appropriate to the level of acuity of the patient. In other words, a sick patient who really needs a nurse there every time, I could do that. And a patient who would get by just with a patient care technician, that's the usual circumstance. We would provide that. In any case, part of our service is to do your labs at home and to have a physician available for televisits at all times. And for patients who want to maintain their relationship with their nephrologist, we make it easy for their nephrologist to become part of our staff and to continue their relationship. And if they don't have a nephrologist they feel is well-versed in home therapies, I would be their nephrologist. And our goal is to provide the best care. The sign on the wall here says better quality of life and freedom through customized home dialysis treatments. And that is really the philosophy we have. And I try to do that in my world as though our patients were our family. And we try to actually use family to take care of our patients. Family members of patients or patients themselves who would be interested in exploring the option of having dialysis at home with us or assisted dialysis at home can contact us, and we will be happy to explore your situation, contact your insurance company when appropriate.